If you're interested in working as a medical or scientific writer in the pharma industry, you'll soon discover that part of the hiring process for any writing job involves a writing test. And these writing tests can sound pretty daunting if you're not familiar with what hiring managers are looking for from a writing test or writing test best practice. But in order to break into medical writing, you will have to pass these tests. And then to progress your career as a writer, you still have to do these tests for every job or promotion that you go for. So passing medical writing tests is what we're going to be talking about today. Interested in a career in medical writing, you need to prove to employers that you have the core skills to present clinical research data in a clear and concise way. The most common way that employers assess this is through a writing test, which is an integral part of the interview process for the majority of medical writing roles. So what are employers looking for from a medical writing test? And how do you know what to include to ensure that you make a good impression on prospective employers? This can be tricky to answer if you're not yet familiar with writing test best practice. So to help address this, I've prepared a checklist of key things that you'll need to consider when preparing a medical writing test. To get a copy of this checklist, just head over to my site for a free download. You'll also receive regular updates on support for your career transitions, working in pharma, and scientific and medical writing careers. Hi, I'm Vicky Sherwood, author of the Biomed Badass blog and host of the YouTube channel where we discuss all things career related for STEM professionals working in academia and beyond. Today we're joined again by Vera Chan, host of the YouTube channel PhD Coffee Time and regulatory medical writer in a pharma company. When Vera was breaking into medical writing, she contacted me about what to expect and what was needed to pass a medical writing test. Here we revisit that conversation, so let's get started.
Hi, Vicky.
Hey, hi Vera, how are you doing?
I'm great. I have a few questions for you since you have been medical writer. I'd like to ask for people who may be interested in medical writing position about the process of becoming a medical writer. First of all, why do company give writing tests?
Okay, the dreaded writing test. Lots of people reach out to me with this question and it's very common. I don't think you will get job offer for a writing job without showcasing your writing. So that's primarily why companies do it. They want to see what your writing capacity is now or your potential writing capacity in the future for them. So they're looking for a natural ability to write and also potential for improvement, particularly when you're at the stage where you're transitioning into your first role in medical writing. Most companies will ask you for a test, but how they do the test is different between different employers. So some people will give you a test in advance of the interview. Some people like to interview first and then give you the test afterwards. And others like to actually have the test done on site. So they'll invite you in for the interview and then give you an hour or so to go away and write during the interview process itself, during the interview day. And there can be varieties on this. So some people will do a writing test before and on the site, and others will do it on site and afterwards. So it just depends on the employer. So you've got to be kind of open to having any kind of test thrown at you from different employers. My personal opinion, it's better to actually have the interview first, because that way the employer knows whether they're interested or not before you take the time to do the writing test. The writing test can be quite an investment of time. It could take you a couple of days, maybe a bit longer, depending on what they're asking for in the test. So that kind of investment in time is not worth it if then you do the test and you get to the interview and they decide you're not the right candidate. You've kind of spent a few days before the interview doing that test. So I prefer a situation where they'll give you the interview first and then decide whether or not to give you the test. But it depends on the employer. It's entirely up to them.
Explain to me, is there any difference for you as a principal medical writer and for me as an entry-level medical writer? Do you think the writing tests are any different? Like, are they the same type of work or are they different activity? Do you have any things to share with us?
Yeah, so this is an interesting question because I always thought somebody who'd been writing for 10 plus years in the industry versus somebody who was breaking into the industry, they'd have a different grading of tests. And they might do it some places, but at companies I've worked at, they use exactly the same tests, whether you're a principal writer who's been writing for 5+ years or more, or an entry-level writer who's going to get an associate position and be their first writing role, and everything in between, from medical writer, senior writer to principal writer. They will use the same test, which is quite surprising. But what they're doing is they're actually grading you based on your ability. So they see how much experience you've had, and then they expect a little bit more of what you're putting into the test, depending on how much experience you have. So if you and I were to get the same test, for example, and I've got on my CV that I've got nearly 5 years of writing experience, they're going to expect more from what I'm putting on, say, you at an entry level. And so what they're doing is they're comparing you to all different candidates they've had writing the same tests over quite a long period of time and trying to observe where your skill set is at and how much investment they would need to do to train you up to get you to a particular level that they need you to be at, depending on the job you're applying for. So as I said, whether you're an associate writer or a principal writer who's been working for 5, maybe 10 years plus, you probably will be getting the same test, but the assessment criteria from the grader of who's reading the test and marking it will be slightly different. As I said, they'll expect more from somebody with more experience.
So Vicky, could you tell us a few examples? What are these type of writing tests that can be given to us when we're interviewing as medical writer?
Sure, yeah. So there are probably 4 common types really that I've come across and that colleagues that I know have sat as well. So the first is an abstract. So you'll be given a scientific paper or data tables around particular messages that you'll have to pull out from the data, and you'll be asked to write an abstract around that. The second is a slide deck. We term that a slide deck as a medical writer, but in academia we just call it a PowerPoint presentation, where again you would summarize the data depending on the audience that you're writing for. So often in the test they will say it's for a scientific audience or it's for a non-scientific audience, and then you would produce a presentation slide deck around who the audience is based on the data you're given. You can also be given a copy editing test. That's quite common. So you'll be given pretty much a short piece of writing, something like an abstract, where there will be several mistakes in there based on the spelling, grammar, punctuation, and sometimes flow of the writing style as well. And they will ask you to mark and copy edit that where there are problems. Last one that I have actually had to write before is a headline. So I've been given pieces of scientific information before and then told to write a take-home headline around those scientific messages, basically a summary of the scientific evidence that you're given. So those are the 4 main types that I've heard of. I'm sure there are other examples as well, but I think those are definitely the 4 most common that you would be expected to write for a medical writing test.
Right. Can you walk us through an oversimplified version of what are the things we need to know when we write a writing test? And do you have any tips?
So one of the most important things when you're writing a medical writing test is the scientific writing. Being able to get the basic science terms right and understanding what the clinical data means is essential to being able to produce the document, obviously. So you've got to try and take time to read carefully the documents that they've sent you, read around the subject and really get your head around the science and what the data is showing you and what the major take-home messages are. That's the first point to get clear in your head before you even start writing.
Do you have a checklist for us who want to break into the role and maybe somehow give an interview and then a writing test? Is there something we need to bear in mind when we are doing this type of exercise?
Yeah, so I've got a checklist actually when I do a writing test of all the things I try to include. So that is good use of English, attention to detail, style of writing, creativity, and also research skills. So showing that I can put the research in needed to look at the background behind the scientific data. So if I talk you through each of those, the first one, good use of English. Obviously that's going to be grammar, punctuation and spelling. It's important to note whether or not you should be writing in American or British English, and you should modify your spelling based on whether or not they're asking you to write in American or British style. Attention to detail is being consistent with the use of abbreviations throughout, and that's really important to note. Using the correct units and also again your spelling. They're looking for really that you haven't missed anything and that you're able to read through your work and QC and check your own work after you've done it before you submit. Writing style. So they're looking for a good flow, a sense of style in the way that you write as well, that you use a beginning, a middle and an end to all the writing that you use. As I said, it flows nicely through the writing that you're doing. This is particularly important for things like an abstract. The next point is creativity. So creativity can be difficult in terms of you've got to give the right scientific understanding and show that you can write in a scientifically accurate way. But particularly things like PowerPoint presentations and slide decks, they will ask you to produce a slide deck and then put in the scientific data, but they won't necessarily say to you that it should look in a particularly creative way. And I think in academia, we don't worry too much about how things should look in that way. But outside in the commercial sector, in the private world and in the pharmaceutical industry, it's expected as an industry standard really to have things presented in a very clear and almost creative style as well. So it's important to try and introduce a creative element, particularly if you're doing a PowerPoint or a slide deck writing test. And the final point that I wanted to mention was research skills. So we are all researchers, we come from a research background. So it's our due diligence really to put the research in and show that we can look up the scientific background to a lot of the writing that we're doing. So when you're given a writing test, you're often given a scientific paper to look at or some data tables. It's important to go away and look at other clinical trials that have been going on with that particular drug, particularly the most recent ones, and also look on clinicaltrials.gov and look at how the research trials with that drug are going on. And that kind of background that you can add into your writing test is a real bonus if you put in that extra time to do the research.
Yeah. So I think the take home would be, don't assume the writing test is a vacuum. It's not just the two pieces of information they gave you, but you're going to perform much better if you are aware of how other people writing style is like, or the word choices, than if you are more able to mimic the same type of language in that therapeutic area. I guess that's in essence people are looking for, is do you fit in that type of writing, right?
Absolutely, you're right. And every therapeutic area will have its own language style and the abbreviations that it uses and things like that. So it's important to try and get a little bit of grasp on that pretty much before you start writing, and just try and understand what the standards are for each therapeutic area and within the pharma industry itself.
This is really helpful to know. And do you have any last piece of advice?
A couple of things actually I think that are also important. The first is timelines really. So it's quite a good idea, even though they give you a deadline on your writing test, to see if you can try and get it in a bit earlier. This shows that you can be ahead of the curve and you can get your work submitted earlier than deadlines, and that always looks good. But obviously if the timeline is very tight, don't worry too much about this, but it is important to have it submitted before and not to ask for an extension. You really do have to prioritize the task and get it done on time. And that's part of the assessment. It's part of life of being a medical writer. You have to meet your milestones and deadlines of the project. But it's also quite a good idea if you've got enough time to do the writing and then put it in the drawer and then come to it the next day and have a look at it. Now, often as a medical writer, you don't necessarily get that luxury of time because timelines can be quite strict. But when you've got a writing test, if they've given you a week, it's quite good to get started early. And then you might be able to give yourself a break in that week to then come back to your writing test with fresh eyes, because looking for things like mistakes and being consistent throughout the writing really helps if you're looking with fresh eyes rather than you're reading it in the last 10 minutes before you submit it. So think about timing and planning how you're going to do the writing test over the period of time that they've given you. And I think another thing that people tend to forget about is actually when you email back the writing test, that is also part of the test. How you write that email and whether you write it in a professional way, whether you're checking consistency within the email, they are looking for that because that is the type of email you would be sending out to a client or a stakeholder within the company that you're writing within. So how you write those emails and how professional you come across is quite important as well. So don't think that just sending back the test and saying, here's my test, how you write a professional email is in fact part of the test as well. So those are two other important things to think about when you're embarking on a writing test.
These are wonderful. Thank you so much for the guide. And I think this is really relevant. As I just experienced my own interview as a medical writer, I think that was also the strategy I've employed. Is I took the first day as soon as they gave me the test to a draft, and I spent another 2 days just reading and picking up errors that I have made. And with fresh eyes and fresh brain is really important as a writer. And also the emails, I think that was also a great tip for us. In reality, when medical writers do the job, all of these writing types, they can be towards scientific audience and general audience. So we need to know both ways of writing.
Yeah, definitely. You need to know your audience. So that's something when you're given the test that they should tell you up front. And if they don't, you're within your rights to contact the employer who's assessing you and ask, which audience would you like me to write for? And also things like whether, if they don't tell you whether it should be in British or American English, you should ask them as well to give you that detail. And they should also tell you the word limit. So the word limit is incredibly important as well, that you stay within it, because if you go one word over, that's a big black mark on the test. So it's incredibly important. There's no leeway on the word limit.
If people are interested to know more about medical writing, what should they do?
Definitely head over to my site, www.biomedbadass.com. I'll put the link in the description below because I talk a lot about medical writing, breaking into the industry there. So if you're interested more about medical writing, head over to my site and sign up there to the subscription, and you'll receive all the information about medical writing coming straight into your inbox.
The audience are interested in PhD career after academic training. This year in PhD Coffee Time, I hope to have different conversation over coffee with people like Vicky. So make sure to subscribe to my channel, PhD Coffee Time, on YouTube, and I will probably show you more wisdom from other PhD alumni like Vicky.
I think as well, your channel, Vera, really, it helps people who are currently in their PhD or even in their postdoc to use things like PowerPoint and writing abstracts better as well. So, understanding how to write for an academic audience and writing as academic is really helpful. If people are more interested in that, they should definitely check out your channel as well.
Thank you. That was my motivation of making those instructional video, because I have many little details and pet peeves that I had, and I think it would be great if someone can teach it over a video. So if you are starting PhD and wanted your training to be compliant to all these standards, that can help you meet the requirement of being in the future job, either in academia or industry. I think my channel helps you to get a hang of what is the expectation during your PhD.
Well, thanks to Vera for sharing her experience of the medical writing test. And I'd just like to quickly summarise what we discussed today. A writing test is an integral part of the interview process for a medical writing position and can be requested at any time during the hiring process. Writing tests usually comprise of writing abstracts, slide decks, headline summaries, and sometimes can comprise of more than just one of these. Top tips for completing your writing test include presenting the key scientific data accurately and clearly, using coherent and logical flow throughout your writing, showcasing a creative side where relevant, conducting research around the type of writing you've been asked to deliver, a thorough QC of your work, getting the test submitted on time, sending it back with a professional email, and of course sticking to the brief in terms of word count and what you're asked to deliver. Wishing you all the best for those writing tests. Good luck.